Welcome! In this lecture, we are going to be discussing health and mental health policy in the United States. This is meant to provide a broad overview highlighting central policies that impact social work practice and the clients and communities we serve. This lecture is really going to be centered around a core healthcare debate in the United States, and that is, should the federal government be involved in providing health insurance? As we'll talk about more in a little bit, historically, there has been very limited government involvement in health policy, particularly in getting involved with providing health insurance. We currently have an employer-based model where most folks in our country are obtaining their health insurance through their employers. Many feel that this has created an unequal system and creates substantial access barriers to some in our country. Others feel that having a more private system without government involvement is more efficient and should be less costly. We will now spend a little time talking through some of the debate and what has been done and not done in the United States around health policy. First, we're going to take a moment to discuss healthcare reform. Within this debate, we often hear discussions of healthcare reform. But what do we really mean when we say that? So the term healthcare reform is used to describe major health policy creation or change, and usually denotes government's role in the administration and delivery of healthcare. In addition, within the debate around whether the government should be involved in delivering health care, we hear some terms that can be a little bit confusing sometimes. So you may have heard the terms universal health care and single-payer health care. And these are really distinct terms, and it's important to have an understanding of what they mean. When we talk about universal health care, we're talking about an organized healthcare system that ensures insurance coverage for all members of society. This can be implemented in a variety of ways, so it doesn't mean that one insurance provider is covering all members of society. So it may be a combination of employer-based insurance, government insurance, private insurance. That is in contrast to single-payer healthcare. When we talk about single-payer healthcare, we are talking about delivering healthcare for an entire population with financing through a single insurance provider. And typically, that single insurance provider is the government. In the United States, there has been continued tension around a healthcare reform agenda. So as you can see, there have been many failed attempts to propose policies to ensure health insurance coverage for all Americans. I want to take a moment to highlight one of these failed attempts that seems particularly important for our discussion today. So as you can see on the timeline, in 1935, President Franklin Roosevelt was considering including a national health care plan as part of the New Deal legislation. As you'll hear a lot more about later in this course, the New Deal was a major social welfare policy initiative that created Social Security and many other social insurance and public assistance programs. What's interesting is that Franklin Roosevelt and members of his administration felt that if they included a national health care policy as part of the New Deal legislation, that the entire agenda would fail. So they made a strategic decision not to include health care reform as part of that important effort. So, in summary, it's really important to note that the historical reality has been that in the United States, there is very limited federal government involvement in health policy. Just for a more global perspective, it's of note that the United States is the only industrialized nation that does not guarantee universal health care to its citizens.